Hi, therapy issuers. Thank you for joining in on our conversation between licensed mental health professionals. This is not meant to substitute a relationship with a licensed mental health professional. Should you become triggered or begin experiencing a mental health crisis, please go to your nearest mental health hospital, emergency room, or dial 911 or 988. And always remember, we are human first and therapist second. Follow us on Instagram, Twitter, Facebook, TikTok, and subscribe to our YouTube channel using the handle @Crave Counseling. This is Therapy-ish. All right, welcome back with another episode of Therapy-ish. And today we have Miss Tracy Long. She is here local to Austin as well. And so I'm going to have Miss Tracy introduce herself, tell us a little bit about who she is, who she serves, where her office is located, and social media handles.
Got it. All right. So yes, my name is Tracy Long. I'm an LPC here in Texas. I see clients virtually and in person. I have a office in South Austin. My private practice is Shades of Resilience Counseling, which I'm super excited and proud of. I am a trauma EMDR therapist and a mindfulness meditation coach, certified mindfulness meditation teacher. The population that I serve is men. I finally just went ahead and made that transition for that to be my niche, men of color, age 30 and older.
I thoroughly enjoy working with men. This is a men safety zone around here. So I was excited when you were interested in talking about men's health and mental health. So I'm looking forward to that. So what made you so passionate about men's health and men's mental health?
So, I was kind of thinking about it. I enjoy working with men, and I noticed that. But then I had to do a deeper dive. It's like, well, where is this passion really coming from? And as I did the reflection, I was super close to my dad. I grew up in a 2-parent home, and my dad was my BFF, right? So I spent a lot of time with my dad, and he passed away. This year it'll be 12 years. And he died from multiple myeloma cancer. And it happened at the last minute, right? And I think of all the pain or the experiences that he must have had leading up to it. But unfortunately, our men just don't go to the doctors. They don't get the physicals. So it was just not knowing. And we're from the West Indies, so we didn't even have any family history to go by. And now I have 2 boys. And every time they go to fill out their paperwork, it's like, what's our family history? And I'm like, I don't know. Let me go dig a little bit. So, besides the family history part, I think of just how that ties into mental health, right? Low testosterone levels, or again, just the pain that they carry physically that's impacting them emotionally, but they're so we're trained, we're trained to kind of just push through, right? Mm-hmm. So that's kind of where it started. Just my dad, my love for my dad, and now my boys, and wanting to be able to, just kind of help other men navigate that.
Okay, thank you for sharing that. I always wonder when other people say that they thoroughly enjoy working with men. I wonder if their story is ever equally as great as mine or similar. Not necessarily great, but similar. And you describing your relationship with your dad reminds me of my relationship with my dad. And so I'm like, I remember like having a conversation here recently with someone, and they even shared it like on my personal social media page, where I was describing like the number one response that I get from like intern/practicum students or LPC associates that are looking to like join Crave Counseling. The number one like response I get on what is a population that you would be uncomfortable working with, the number one answer is men. Mm-hmm. And I really had to sit with that as I continued to get the answers, because I was like, why are people so afraid of men? Now, social media and like some people's real world experiences, I understand the fears around it. Mm-hmm. But when I think about what you just said and like me processing what you just said, I'm like, all the men in my life were safe for me. All of the men in my life supported me, and without them pushing me and teaching me and showing me that I can do anything possible. Not that my mama didn't. I'm not saying she didn't.
I hear you loud and clear.
But it was just like, it's different.
Yes.
It's different. So thank you for sharing that.
Yes.
Okay. What areas do you feel that we as healthcare providers and mental health providers struggle with the most when it comes to supporting men working on their overall wellness?
You know, one of the areas that we probably struggle with the most is just kind of that level of, I guess, some of the stories, I guess, just kind of what you mentioned, right? Is like, what do we bring into the therapy session that may be blocking seeing them differently than their experiences? And I think that's where men kind of get played short, right? And that's the best way I can describe it, is they get played short because it's automatically assumed that this is the reason why you're responding this way, or you're doing this because of this reason. So I think it's more of just that sense of openness, and to really be reminded to take our own personal stuff out of the therapy room. But one of the other things I think is important is to remind our men to go get their medical, send them to go get medical checkups. During my LPC supervision, my clinical supervisor always asked, well, when was the last time they had a checkup? When was the last time they, had a physical exam or some blood work? So always kind of rule out, right? Process of elimination instead of us just going straight to the mental aspect of it. So I think, reminding, even in session, we're meeting our men and just like, when was the last time you've gone? Because there are a lot of things that are overlooked, and to be able to help them to advocate, like, what do I even ask for when I go in there? I would say a lot of the research are not necessarily done or based on statistics related to people of color. So the guidelines may be different as far as, well, you haven't reached this age to have this test done or that test done. And to just help to empower them to be able to ask for things, right? Because are you just being pushy? Are you being too assertive? Are you trying to, kind of tell me how to do my job? Because there was an experience that I had with another gentleman, and he shared it as like he found out he had prostate cancer, but he was too young for those assessments. But he went and insisted on it, had it, and obviously he's doing well now. But the interesting thing about it is that, well, his father had it, an uncle had it, a grandfather, but they didn't talk about it. Nobody mentioned it. And he was kind of upset with them for a while, but he's like, why didn't you tell? Well, that wasn't my business to tell you about Uncle So-and-so, right? So I think, again, empowering men to be able to talk about, to empower them to be able to go and get these medical assessments, and then to just kind of be open and truly hear their experiences, and not compare it to our own history or view of men, I guess.
I like what you said as far as the barriers that some mental health professionals come in with, because it just piggybacked off of what I just said. The other part that made sense to me as well is you basically saying sometimes conversations are not had within families, and it keeps us from getting the information that we know. Now, I think a huge part of that is just how we communicate very differently.
Yes.
But I think that during family gatherings and, or even, the women in the family, when information is disclosed to you, that needs to be disclosed to everybody in the family, because 9 times out of 10, the women know everything.
This is true. This is true.
I can tell you everything about my granny. I can tell you everything that's going on with my uncle. I can tell you everything that's going on with all of these people in my family. And I don't even talk to these people every day, but It's just the word of mouth trained, because the women in the family communicate so well. But I think a huge part in the other part of it being a barrier for mental health professionals is that sometimes we have clients that don't have the words.
Yes.
Because like you said, it's not something that they normally do. They're taught to get this money, take care of this family.
Yes.
And if they made mistakes in their past, that's the only communication that people have with them
Yes.
is about, this is where you messed up.
Mm-hmm.
You know, we done rid you to filth because you made this one mistake and we'll never let you live it down.
Right.
But I think, you know, with that being said, we get clients that come in and they're trying to explain to us like what's going on with them. And then sometimes it's the assumption that we understand.
Yeah.
And sometimes I'll be like, what?
Yeah, for sure.
What are you talking about?
Mm-hmm.
And they're like, you know what I mean? And I'm like, I don't.
Right.
And I could possibly read between the lines from time to time, but because we are different people and our struggles are different,
Mm-hmm.
I can't assume that I understand what you're saying.
Right.
So providers have to work really, really hard on teaching their clients,
Yeah.
I think this is what you're trying to tell me,
Right.
but let's use the emotions wheel. Let's use this.
Yes.
Yes. And then the other part is getting them in the office, I feel like is the number one barrier. It's
true.
almost as if, you know how people say when you get sick and tired of being sick and tired, then you go and get the things you need.
Mm-hmm.
I feel like they be sick and tired of being sick and tired of being sick and tired of being sick and tired of. And it continues until they hit an area in life that, or a space in life that they didn't know was a thing, or because it got so bad they couldn't cope.
Absolutely. I absolutely agree with that.
So,
yeah. And it was funny, you know, I guess just thinking of that as a follow-up is the questions I tell my clients. I'm like, I'm just here to, you know, I ask a bunch of nosy questions, right? And my male clients are like, I didn't think about that. You always see that pause in their brain, click, 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 click. You know, because no one's ever asked them those questions. And when they leave, they never have the answer usually in there. But I thought about what you said.
Yeah.
And then they'll come back and no one's ever asked me that. So, yeah, I think questioning is huge.
I remember seeing this, I'll make it short. I remember seeing this story on, I think, Instagram. That's my space that I operate within when I'm bored, right? And there was a post about this woman. She basically was stating that her husband was a provider and there was a point in which he was struggling with the finances. And she had been secretly putting up like $600 or something of the nature each month. So when things were getting rough, the wife was basically like, you just need to go get another job. It's your job to provide. And I don't care about like how you feel. I feel like maybe I insinuated that there was a mental health component where she basically was saying like, get over how you feel.
Yes.
I think that that's what I interpreted from it. Like, get over how you feel. You need to get out here and get this money. And in my mind, that's counseling worthy if I were in the husband's position, because now I have to make a decision on, am I leading this family? And who did I marry? And is this a mutually beneficial relationship? Now, hear me out. I understand that marriage is what it's supposed to be, right? I've never been married, so I can't attest to that. But I came from a 2-parent household and my parents have been married since I was very, very young. So 20 years plus. But it's like some men will just take it and just be like, well, I got to go make more money.
Exactly.
And I understand the logic behind it because you've been conditioned to believe that your sole role on earth is to provide. But on the flip side of that, it's like, why are you playing in my face? Why are you playing in my face? That's how I would feel if I were on the other end of that. And I would personally have to go to counseling to make sure that I don't knock everything over.
Absolutely. You know, we think about it and it's, you say that, and I think maybe even Chris Rock said it, and my partner's like, you know, if a man can't provide, he has no other value. You know, where's the space that you can be vulnerable and get that nurturing? It's like, how do we expect our men to go out there and be men, right? Every day you wake up, the struggle is so different for them. Never mind a black or brown man in America, and that struggle is constant, right? So when you come home, you know, just being able to like, okay,
I
Well,
feel
I'm
safe.
struggling. Yeah, it's like I should be able to be sensitive or emotional, right? Why do I have to always be so hard? And be able to get that in return. Like, I'm sorry, like really validating that so that you can encourage them to go back out.
Right.
Right. I say it all the time. Like, just like you said, where's the mutual benefit? I was like, but what do you get out of this? And sometimes they look at me like, huh? And I said, but you have a choice. But, and I'm like, are you happy? Well,
I'm committed to this. This is the commitment that I made to myself, my family, my legacy, and I'm going to stick beside it no matter how difficult it gets for me.
Exactly. And I asked them, at what cost? They're like, no one's ever asked
At
me
what
that.
cost? Okay.
Yep.
All right. So what research do you feel like is still missing, or what is some research that you would be interested in doing to help us spearhead how we approach men's mental health and health?
So I think one of the things I forgot to mention is I'm race-based trauma is also one of the areas area of specialty. And I think we have to go back in the research that I would like to do is kind of go back a little bit more into history, right? And think about, I don't know, I want to say the evolution, but the things that are in our body, right? I think about trauma and how that carries on from generation. Yes, the epigenetics and how that carry on from generation to generation. And to really be able to make that more connection to the physical aspects. Because again, test research, a lot of things just aren't designed for us. So the results or the research isn't accurate on how we should approach certain things. So I want to do just a deeper connection into how the medical aspect, just the major impacts that it's having on their psychological and emotional health.
I actually got The Body Keeps the Score in the other room. One thing that I don't see a lot of literature on is exactly what you're talking about, one. But two, I think that a lot of the literature that's out there was conducted by non-Black individuals. And it kind of goes back to the pre-conversation we had about like getting my license in psychology and like doing research and different things like that. But to add to the research not being there, there's a historical component that is also very much well whitewashed and removed from textbooks. Like even right now with Texas was like one of the first states, Texas and Florida, removing the language around it. There's some museums that I went to, like in New York, where they were considered migrants versus enslaved people. Yes. There's a lot of whitewashing that's happening, and it's like, okay, there's significant research on the percentage of people, Black men specifically, that have suicide rates, that have depression, that have anxiety. But it's like there is a lot of like we said, whitewashing of the research that's done, and there's a lot of missing components that's not included in the research. And it's almost like, then how do you heal an entire population if no one is doing the research to better help us understand? Right. And what you just said before is like not talking about the family history. I literally talk to my granny every other week or every couple of weeks. And I'd be like, who owned the black Jews in South Dallas and the land that they owned there? And, what was your childhood like? How did we end up in Texas? Right. All the Black Native American part of our family, like all these questions and things that I ask, and I'm able to track it back. But I'm interested in those things, and I don't mind doing the work. And I'm like, Grandma, give me this document. Right. Give me a copy of your great-grandmother's birth certificate. Give me a copy of this. So that if I have children, when I start having children, I have all of this stuff to backtrack, even on my dad's side. Backtracking back to Nigeria, tribe, all the things. So it's like trying to do that. Even my stepdad, which is my dad who raised me, backtracking his Louisiana roots and Shreveport. And it's that stuff I want to know. But it's important because I know who had schizophrenia. I saw how it skipped generations. I saw the trauma that was passed down. Like, I can see it not only from a clinician standpoint, but from a historical standpoint.
Absolutely.
Like, we went from being Catholic in our family to Baptist. There was a lot of Black Catholics back in the day. So it's like, it's a lot of stuff that I'm able to connect and, you know, better understand that helps me identify who I am as an individual, but also how I support people in the therapy space. But again, it goes back to the research. If we don't have birth certificates, if we don't have, like, I found all the land that my family owned.
Oh, wow.
The store, everything.
Wow.
And it's like, I got copies of that pulled right off the website.
Oh, you're lucky.
But I know names. I ask questions, so I know names. But anyway, research. It's just, there's a huge component that's missing because Black people used to do community living. Then slavery happened. And now we're in this position where, as a community, we're struggling, which further adds to the stressors within the Black community because not only were we stripped away and all the things, but the role of a man changed.
Right.
and the laws changed, women's rights, women's suffrage,
yes,
and the impact that had not only on other communities, but specifically the Black community. And that translated into, we don't need these things anymore. We need these things.
Right.
This is your only role. When in reality, there's research that basically states that Black dads are more present than any other race. And it's like,
that's not how
that's not how it's portrayed. And I know that to be true from my experience and watching my brothers raise their children and my dad and all the things. But
Yeah. Well, it's I think it's something important that you mentioned because when I said you're lucky, right? Because one of the things I didn't really mention that I should have, because I do identify as Jamaican American. Well, I just kind of switched that recently because it's like Black American, Black, which I always wondered when did it change from Black to Black American? But being Jamaican American, there's a lot of things lost. I think I only go back to a little bit of the story that my parents have told me about my grandparents. I didn't have my dad's side. We know nothing about his family really, right? So, and then even being in Jamaica, what is the culture? The culture there is very different, right? They're ruled by the British, but then their lifestyle and how does that impact them differently than culturally here. In the United States. So even learning more about slavery, people automatically think I know my roots isn't here. I don't know about, a lot of that, but I do understand now how much, or I'm developing a better understanding about how much that has played into just, again, the epigenetics moving forward. But yeah, there's so many unknowns when you come from another country.
I remember when I connected with my bio dad, one of the first conversations we had was, he just disclosed it like such and such died of cancer, this and that. And I was like, this is what I needed. Yeah.
I mean, I started to see it. Oh, my uncle did. And wait a minute. And I was like, oh, this is really something on my dad's side that we really didn't pay any attention to. Yeah. So.
I remember being a kid going to the Dallas Public Library. They have a library downtown. It's like 6 floors high. Nobody goes to it much, but I remember just, that little machine where you look through the old newspapers and you switch the little thing to look. I used to do that as a kid.
Oh, wow.
I used to literally do that. And my mom used to take me to the library, and that was one of the things I used to do. She would do her homework, and I would just be exploring the library freely. So there was the Dallas Public Library downtown that I spent a lot of time in, and then the Dallas Public Library, the South Dallas location on Martin Luther King Boulevard.
Okay, so that research, yes.
Okay. If you had to have a conversation with a man or a young man regarding how to have conversations around health and mental health, around things that are always missed, or just on things that they're not aware that is probably important to what you talked about earlier about like coming to healthcare providers and not necessarily advocating for themselves. So what do they need? What script would you give them if you had to give them a script?
I kind of thought about this question and it's long. But I think just the basic, let's have this conversation, right? To just, to be okay with, let's create this space. How are you feeling? Because again, it's easy to tap into the physical before you can tap into the mental, right? So I think being able to remind them of physicals, what do you ask a doctor, when it's time for you to go in? What tests are you supposed to have? What does my insurance cover, right? Because I think a lot of times some of these men have excellent insurance and they don't use it, right?
Don't get me started on the...
So really just like, I want all of this workup done, and to remind them of, it's for you to live longer, right? Like, we have to know what we don't. Oh, well, I feel fine, right? But what we don't know, we can't treat and we can't help. So it's more of, there isn't something wrong with you. Just, I guess, think of, well, how long do you want to live? What do you want that to look like for your kids and for your grandkids, right? You're not doing, your future self or your future generation will thank you for this, right? To really just kind of, I think that's, I can't really put it in a script, but just really encouraging them, like, it's not for you now necessarily, yes, but it's for the generations to come. And that's how we break cycles, because I'm very big, right, on that too. This the intergenerational, generational trauma, and like, how do we stop doing these things that it was okay, I guess, but it's no longer serving us, right? Because just to stop that cycle and to be okay with wellness, physical wellness first, and then to be able to connect it with the emotional wellness. That headache might mean something. Right? So go get checked out.
Yeah.
Right? And it doesn't always have to be medication. Advocate for doctors that look like you. Right? Advocate for a male doctor. Ask for what you need or what you want.
I don't think a lot of people realize that they can use their out-of-network benefits for providers that don't look like them, that are outside of their network. But I'm going to do a whole different episode on that.
That's a
I'm going to do a conversation on that. That'll probably be a solo podcast.
Yes.
Because it's going to be me rambling, essentially.
Oh, no, that's a good one.
But what I'm hearing you say is the first part before going to the doctor is to ask questions within your family.
Yep.
What cancers are present?
Yep.
What mental health issues are present?
Yes.
Who had difficulty having children in the family?
Yes, that's a good
Are
one.
there any, because the female-related issues can be passed down.
Yes.
So do you have people in your family that are having hysterectomies at 25? Or like, what's going on with your family indirectly?
Yes.
Like you said, the testosterone levels, looking at prostate size or testing for, I think it's prostate fluids. I forget what the technical term for it. Also, headaches, dry skin.
Yes.
That means something.
Yes.
You could definitely be dehydrated and your mental health is struggling because when there's not enough, fluid going to your brain because you're dehydrated and your cells are shrinking, then that's a sign. So it's like, first things first, who be sick in this family?
Exactly.
Who be sick? Just like that, who be sick in this family?
Exactly.
Who passed away early from something? Who had addictive behaviors and tendencies, and what was their addiction of choice?
Yes.
So that I know to avoid maybe these medications.
Yep.
All the things. Who had cancer? What method of beating cancer was used?
No, that's true.
A genetics test. I got one done last year or the year before. Genetics test.
Yeah.
Your insurance cover it.
Your insurance will cover it.
Now, you might have to get some pre-authorizations, but for the most part, it gets covered.
Well, what are the questions to ask? What are those, I call them buzzwords, right? Because you said you have to get a pre-authorization. Well, what do you need to say?
Yeah.
Right? For them to go ahead and decide that it's important.
But you have to know family history to know what to say, because for the cancer screenings, because I had got a cancer screening that was covered by my insurance. Of course, I don't have it, but I wanted to know. But knowing who in the family had cancer, they can use that information to determine medical necessity for the test. I think I can start getting mammograms now because breast cancer was a thing in my family. Like all these things. So it's like the buzzwords are who be sick in his family.
What about if you don't know?
That's what I'm saying. The first step is to have the conversations within your family. Now, your family may not know, but you also have to decipher who was blood relative and who wasn't, because there's a huge biological component within the Black family. It's interesting because Black families don't officially adopt much now, but in the past, we would unofficially adopt people.
Oh yeah.
Like we have several family members that are not blood related. So it's like also what information is true to you. That uncle that's not your uncle, that your daddy took, adopted officially and stamped his last name there. Is that information relevant or not? But we have to have some very honest conversations. Whose dad is it?
Or what about, I don't know my dad.
That's a whole nother podcast.
Right? I think of, yes, this is the reasons, because I know my family has this versus, I really don't know. And I would like to know.
Yeah.
So that I can tell my children.
Yeah.
Is that enough? Instead of, I'm embarrassed to even say, I don't know my dad, or maybe I don't even know my mom.
Yeah. Right.
And not to be, the stigma that might even be attached to that.
But we got to get away from the conversations around family secrets.
Yeah. Yes.
I think because I'm a clinician, I'm one of those people where I'm going to challenge. Now, I know I'm not perfect. Like I'm not perfect, but there have been some very difficult conversations that I've had to have within my family. And there has been times where I've had to literally take off from work to have them. Because it was a lot for me to have the conversation because I'm like, I'm going against the grain.
Yes. What you mean? I'm
and I'm everybody's favorite. Me and my brother is like everybody's favorite in the family. And so it's like when you're having the conversations and you're everybody's favorite, it's like how can I speak to this person's heart and not their mind? Because this is important to me.
Yes. And
regardless of the shame, regardless of the guilt, regardless of whatever you are dealing with, I don't care. I have questions that I need answers to, and you're going to give them to me.
Yeah, I agree.
That's just such and such. They going to take that to their grave. Not with me.
No.
I don't care how many times I got to go knocking on doors. I'm an in-person person.
Oh, yeah.
So if it's a difficult conversation I have to have, that's why I say I got to take off work because I got to go home.
Yep.
I'm taking people to lunch. We having car ride talks.
Yep.
It's happening.
Yep. You can see the uneasiness. Oh, I think I might need to ask a little deeper question. Exactly. You
don't escape from this conversation, but we gotta start with the conversation at home.
Yep. Only
then can we fully have the conversations with our healthcare providers, because if we don't know, like you said, the history, like I think high cholesterol runs in like a certain lineage of my grandmother's siblings, but not her children. But there's some, you got to connect.
Oh yeah,
who this belongs to?
You need a genogram.
Yeah, who this belongs to, and then go into the healthcare provider's office, because those are preliminary questions they ask you. Who has what? Is there a history of hypertension? Do you guys have headaches, epilepsy? Like, what's going on in your family? Is there a history of low testosterone levels? Is there a history of uterus issues with it? They ask those questions whether it's a man or the woman. And so it's like, only can you answer those questions to be able to have your healthcare provider challenge you on or question you on or run certain tests that you may not understand or know that you need. Because if you're not coming in here telling me that this entire paternal side, has cancer, I don't know to run a cancer screening on you.
Right.
So we have to have the conversations.
Right.
Same with mental health. If I don't know who in the family has schizophrenia, like, it usually skips generations. It's usually passed down. Yeah. Who had it?
Right.
Who had it?
Right.
So I don't know to screen for schizophrenia and that multicultural component that we as healthcare providers are supposed to include
Yes.
in our experience with our client and in our assessment with the client. We can't do that.
Right.
Because I'm assessing you maybe on the here and now. And in reality, it's here and now, then and then and before,
right,
then and before, and
right.
It just keeps going, right? So,
right, for sure.
Yes. Okay. Right. So that pivots into my next question. We're almost done. We got one more question after this one.
No, that's good.
As healthcare providers, how can we provide a better quality of care, provide education, and empower men to take control of their health throughout the duration of their care?
It really depends on the population, right? I think the population that you're going to serve, if you're going to see men, or if you're going to do, I guess even couples counseling, right, is to do some more research or understanding on men, so that you can approach it differently, like your sessions or them differently, to be able to get the answers that you're looking for from them. So I would say, I guess, ask me that question again. I think you said, as healthcare providers,
how can we provide a better quality of care, educate our clients, and empower them all at the same time?
Right. So it starts with educating ourselves. Is kind of where I wanted to go with that. Educating ourselves, and then being able to develop that rapport, or to create an environment that makes it safe. Right. I guess for me, there isn't a whole lot that surprises me. So I can have these conversations where it's like, oh, okay, I feel comfortable to say this, that, and the third. So really encouraging them and reminding them that this is a safe space. I'm asking these questions because, and then with this information for you to be able to make an informed decision on what you would like to do next. I think it's just the kind of the education piece. If you go on, we educate to be able to educate our clients, and then to allow them to be able to advocate for themselves or feel empowered to.
Heavy on the safe space, because what we led with earlier, providers that are afraid of men. And again, some people come with their own traumas, their own experiences, or what they perceive to be true based off what they see on social media, based on the horror stories they hear from us. Like, it's kind of like people talking about marriage, right? Like, I don't want to get married because there aren't any marriages that I've ever seen that has been successful. And it's just like, calm down.
Yeah. That always,
there's no such thing as, I ain't gonna say successful marriages per se, but there's no such thing as always healthy marriages, because there are seasons to marriage, and not every season is going to be easy, and not every season is going to come without default or problems. And so it's like, when you think about successful marriages, you see two people, or at least one person that was willing to fight when the other wasn't. And then that teeter-totters from time to time. But anyway, it's kind of like talking about marriage. I haven't seen any successful marriages, so I don't want no parts of that.
Right. Or you bring it, and again, I think about it when we think of ethics, we think of our own biases. Like, you can't bring that into the session because you don't know what you're missing.
One of the questions on my interview questions, and I always encourage therapists or people who are leaders in hiring in any space, is like, what's a bias that you struggle with, and leave it at the door. Right. I need to know that. Right. Because if I'm going to trust these people to come to you for therapy, for healthcare, for you selling my product, whatever, I need to know where you stand. Yep. Because absolutely. how can I ensure the safety of these people? Yep. If you ain't did the work. Yep. So, alrighty. So, what do you enjoy the most about working with men in the field?
I think the thing that I enjoy the most is helping them to make connections. It's that time, like, when you see that aha, kind of like, oh, right? To help them to get rid of some of that heaviness, or, I could think the heaviness that they carry, right? To be able to be emotional. it just, it's nice to allow them to be themselves, be sensitive without judgment, right? You let all the guard down, you know, you can come dressed as you are. You don't have to, you know, I want the real you, right? Not what you have to present in the world.
What the church folks say, come as you are.
Come as you are.
Come as you
right? And, you know, I think the thing with me, why even I am, how you see me dressed is how I show up. Right. The conversations we have, I speak just like this to my clients. And I think that's the part of just making it welcoming. So when we have these, there's humor in there, and just being able to, again, to make them relaxed and to see, oh, now I can do this. They're able to develop relationships with their kids, reconnect, because now they're learning how to communicate differently. And then they're able to be great grandparent, like, some of them, you know, like they take on the role of grandparent, like, oh, shoot, I didn't even know, right? But if they didn't mend the relationships with their own children, they would have lost out on the ability to be the different person for their grandkids, where their kids are like, oh, wait a minute, you're not that person. So now I can let you into my kid's life or whatever. So I think just watching that, being able to mend relationships and to enjoy whatever, you know, whatever time they have left here.
Yeah. I think I thoroughly enjoy the exact same thing of connecting the dots. But the other part that I really, really, really enjoy is challenging their level of vulnerability.
Yeah. That's a good way to put it.
And where that level of vulnerability was based off of. Mm-hmm. Like, where did you learn
yes.
that?
Yes. Yes.
And how is that impacting your ability to set boundaries?
Yes.
Your ability to find your value?
Yes.
Your ability to challenge the people that's harmed you, no matter what society says that you as a man is supposed to sweep under the rug.
Right.
Challenging those maladaptive connections that you have within the you know, with the women in your family.
I was just going to say that, with the women in your family, right?
You know.
What are those relationships with mom?
You know, I be trying not to say too much controversial stuff for the sake of safety, right?
Yes.
But there are some days where I just be like, there is a lot of things that one stem from slavery that transcended into maladaptive community connections that also was coupled with the crack cocaine epidemic, that was also coupled with women's suffrage and feminism. Again, I ain't gonna say too much on that, but that's a whole conversation by itself.
Yeah,
and
you just made me think. Yeah,
I know
that is
for
a
a fact
conversation by itself.
I'm gonna get tore down when I finally have that conversation. But it's okay. I'm okay with that. My job is to challenge.
Right. But I mean, there's so many layers to that, right? Mm-hmm. When you think of, I mean, we could just go on, right? When you think of welfare, right? That was brought into the home, and now the man can't be there if you're going to get these benefits. But
who created? Where did they get the welfare system from?
Exactly, right? So now you're dividing the home.
But
right?
Where did it originate?
It was the government.
Black Panther.
Yeah, well, that too. Yeah.
Come on now.
Yes.
We gotta continue to connect.
Yeah.
It started there.
Yeah. And
it was beneficial to the community.
Right.
And it was helpful. Community living, having our own these things, right? Then
it twisted it, yeah.
We got a government-based program that's similar, that is based off of data, that is based off of ghettos and boroughs and all the things. And we're going to use the data that we need to shift how these communities network together.
Right.
On top of that, we are going to bomb every major establishment that is allowing their welfare system to work.
Right.
So that we now have to do this. And now you're enslaved again. Again. Now you're enslaved again.
Yeah.
So it's like, then there's again, I understand women's suffrage. I'm a woman, a Black woman,
yes,
but a woman.
Yes.
So I understand where some of those things came. I understand feminism and what it's meant to do. But everything is always a double-edged sword. Like healthcare, for example, mental health care providers can be conducive to the growth and the progress.
Yes.
Mental health providers can also be harmful and dismissive and further instill or install that negative cognition that someone already had before they came in the door.
Right.
But again, I digress.
Yeah.
We got to look at the whole aspect of when you're working with men, Black men specifically, do you understand every aspect of what is happening?
Right.
Although it's here, right? This is his small thing. He's dealing with maybe sexuality. Maybe he's dealing with identity. Maybe he's dealing with his nuclear family. And then maybe he's dealing with his extended family. And maybe he's dealing with in-laws. But in that, there's some intergenerational trauma. There is some government-based trauma. There is some healthcare-based trauma. There is system-based trauma, educational-based trauma, like all the things in between because of the color of your skin. And as a healthcare provider, how can I do my due diligence? One, if I'm not putting myself in these communities, whether I look like you or not.
Right. And
am I bringing my bias into the space based off of my family upbringing, whether I look like you or not? And did I do my research first before I stepped into this space with you? Right. And do I understand? Again, I know I'm not always 100% right on data and connecting the dots, but I'm usually 90% spot on. So it's like, I understand all the things and I know to challenge, well, this was your relationship with your dad. This is your relationship with your child. Your dad's relationship was this. There's a connection. Then if you go back to your dad's dad, that wasn't his dad, so he got treated bad, so he treated you bad. So it just kept passing down. And it's like, if you don't know to think beyond this generation and the one before and the community systems, the things, then you don't really know how to deal with the problem in front of you.
You know, I mean, it's just so many layers. So many layers. And just, again, like you said, keep those biases out of there. Right?
Yeah.
And just ask the great questions.
Yeah. But see, the one thing I don't talk much, oddly enough. I literally don't. It takes a lot to get me to open up and talk, period. But I think that would be the same for a lot of clinicians because we do, if you're a thorough clinician, right? You work hard, whether it looks like you work hard or not. You know, sometimes clients be like, what you finna do after me? Go home and reset. And they be like, talk to me. Well, you got kids. Can we? No. Listen, I care for you.
Yeah.
Your problems are not my problem.
Child.
Your crisis is not my crisis. I empathize with you right now. You ain't got to go, but you got to get up out of here.
For real.
Because I got to go.
Great.
But with that being said, it's a lot of work that comes with it. And if we as clinicians don't open up and talk about it, we don't know that these things are missing. Because kind of like therapy, right? You connect the dots in therapy by communicating, by talking, by challenging, by research and reading and all the things. Same for clinicians. I have to talk about it with other providers. I have to do the research. I have to communicate with other providers the patterns that I'm noticing that is going under the radar. Like this conversation. We connected the dots with communication.
Right.
It starts at the family unit.
Yep.
Who be sick?
Who be sick? That's true.
Who be sick? And if I don't know who be sick, I can't tell a doctor who be sick.
Right.
And the doctor can't tell me my statistics based on the smaller labs and tests that they're running when in reality they need to run a full panel.
Right.
But I can't start there if I don't communicate.
If you don't communicate. And the last thing I guess I would just close with is to make sure, we should never stop consultation.
Absolutely.
Right? I think, like you said, none of us know it all. So it's like, well, I'm thinking this. To be able to bounce that idea off of somebody else because they can see it very differently. And for me, I don't always, you said feminism, I don't always side with the woman. Right. And I think, you're just like, well,
because we got our own trauma within the Black female intergenerational dynamic.
But just being able to understand it with a clean, just like at the base level. Right. And I think too, again, it's just where's that support? There's a lot of, women specific stuff. And there's just not enough men empowerment specific stuff.
There is not anything.
And then I think just because they don't need it. And I'm like,
well, again,
however we look at it.
Well, again, I don't know that they don't need it. I don't think the conversations are being had.
Right.
And again, a huge part of that goes back to the conversation I mentioned or the thought that I mentioned about what is your idea of vulnerability? Because only can you grow through vulnerability.
That's how connections are made, right?
Yes. So if your homeboy don't know you done had this headache for 6 weeks straight.
Right.
Like, I think men, even though men might, some men may not go to the doctor themselves, they will encourage their do as I say, not as I do. I think that's across the board anywhere. But I think if you're a friend who genuinely care about you and knows that you've been struggling with a headache for 6 weeks, they're going to try their best to help you get where you're trying to go. Now, you got to receive it.
Yeah, you have to receive it.
You got to receive it. And that's across the board for anybody. But I think, again, the most important thing is vulnerability, communication, challenging, and reframing those negative cognitions, beliefs, theories, methods. Because just because your grandmother, great-grandmother, your mom, your aunt, because again, who's in the household has told you that this is how you operate with women, or this is how you should operate as a man, or that doesn't make it okay, and that doesn't make it right. And also, are you identifying the toxicity within those relationships? Two things can hold true. Your mom can be very helpful, but she can also very much well be very harmful. Your sister can be very much well helpful. She can also be very much well harmful. Two things can hold true at the same time, but you got to be honest.
Right.
And you got to be willing to challenge. You got to be willing to be vulnerable.
Right.
And open.
Right. So for the month of, and I didn't even say it, for the month of May, I'm starting with just a live Q&A, right? Where I'm encouraging men to either call in. It's going to be a safe space where it'll probably be like either via Zoom. Like I don't want it to be live on Instagram or Facebook. Or they can email me or text me questions because I want them to be able to have that space to be able to ask those questions, to encourage them to take that next step. Like, what are those questions or those things that you're scared of that are you're concerned? Like, what is it going to look like, right? To be able to bring that in, because as you said, vulnerability is a sign of courage. So, the tag that I came up with is no shade, all courage. Right? It's like, no, I'm not throwing shade on you, right? When you think of that love. No, this is no shade, all courage. Come in and be able to kind of talk about that a little bit, because that's where the strength is just,
Okay, I promise I'm not going to go on another rampage, but what you just said made sense to me. I remember hearing somewhere, or I read somewhere, hurt ears hear different. So when you say no shade, that's the same thing, right? Like, hurt ears hear different. Just because I'm challenging you doesn't mean that I am being harmful to you.
Right.
I'm not trying to hurt you. But because you might see from a lens of trauma, you might see from a lens of pride, you may hear from a lens of toxic masculinity, whatever you hear from. I promise this is not an attack. We're having a dialogue.
Exactly. Yeah. So tying all that together and hopefully be able to just, continue to do this work and create these spaces.
All right. So tell us where you are again, social media handles, and also, do you take insurance or you cash pay?
So I have two. Yes, I am accepting Aetna and United are the only two that I accept right now. So primarily cash pay, but I do offer session packages to try to help with that. And I'm actually thinking of this component again because I think of men, right? How can we? I was kind of shying away from those 30-minute sessions, but I'm also offering those so it could be those quick 30 minutes, affordable. And then I'm also creating digital tools to just be able to help with that. So I'm here throughout the state of Texas, virtually and in person. Social media, I'm on Instagram, Shades of Resilience Counseling, Facebook, but I don't get a lot of traffic on Facebook. And then always my website, email.
Thank you.
So I appreciate this opportunity to talk about.
You know, one thing I thoroughly enjoy about like doing a podcast, because there's this thing, keep Austin weird. And I just want to show like there's not everybody is keep Austin weird. And so when I meet other people that are not from like the keep Austin weird space, it's not intentional because JC does like all the legwork. I just show up and do the podcast. But it's like when I meet other people in Austin that's not keep Austin weird, I'm like, oh, okay.
Yeah.
And so there, I think that there's a lot more clinicians who are not keep Austin weird, if that makes sense. No shade to the keep Austin weird culture or community. But like transplant people who've moved here, and I know Native Austinites got a feeling about that, but there are providers in Austin that would probably still meet your urbanized life or where you originate from.
I'm originally from the East Coast, so I bring a whole different.
Yeah, I'm from Dallas, so
yeah,
I grew up in the hood, so it's a little bit different. But yeah, thank you.
No, this was awesome.
All right, so I'm done rambling.
I know, you like just go on.
Yes,
this was nice
because like we as clinicians, we never get to talk. No, but that's neither here nor there.
No, and I stay in my bubble. Like I don't cross the river, and I know this is where where we are.
Well, I think it goes back to community living, community servicing. We just don't serve together, and that's okay. We just got to find each other.
We have to find each other. Absolutely. So.